I love that it is a small enough hospital and small enough organization where, in medical community, that we can bond with each other and work well with the administration. But it is large enough that we can achieve a tremendous level of care, expertise, and we can really impact the healthcare of this environment.
It's important to have Titus Regional here in Mount Pleasant because there are so many communities surrounding us. And when you have a very sick family member, having to drive 45 minutes to over an hour and a half to get to a physician is sometimes the difference between life and death.
I think as we become a regional healthcare center, which I believe is the physician and administration's goal, we will be able to draw on more resources such as expansion and renovation of the ICU.
In September of 2014, I realized that I was going to need a growth that was on my thyroid taken care of, and so went to Dr. Cuenca, and it was determined that she would be doing a thyroidectomy. Just her care of me in that particular instance and in the years since was phenomenal. I think any time that you can go within 20, 25 miles from a small rural community where we have decided to retire, and to me, to be able to come closer to home is very important.
The expansion and renovation in the ICU, which basically will take over the entire third floor of the medical complex, will allow better monitoring, better delivery of state-of-the-art technology, and at the same time dovetail into our other specialists and allow them easier and more immediate access to taking care of patients.
Be able to care for patients of different level of complexity, but also customer service to patients, to their families. They're going to be able to stay in Mount Pleasant and have excellent care, second to none.
As we know that we are going for primary stroke centers in the next few months, so most of our patients will be coming in and they will be staying in this hospital. The stroke care needs ICU management. We are also recruiting intervention cardiologists. For that, we will be needing good ICU rooms.
My husband woke up sick and his heart was hurting, it was racing, because 20 years ago, he had had a heart attack. We thought he was having another heart attack. We came to the hospital here in Mount Pleasant. They kept us informed every time so that we felt comfortable.
What our goals were when we decided and were designing the intensive care unit were to try to make sure that we're not like a textbook, that as soon as the textbook comes out, it's already 5, 6 years old.
Currently our ICU consists of 8 rooms, and 4 of those are in a bay open area. The new ICU will have 12 private rooms. It will have 6 progressive care or intermediate care rooms. We will be able to have the capability for dialysis, for meeting bariatric needs, for epileptical monitoring.
We're setting up for video conferencing, for video evaluations of patients in the future. We're trying to make sure that from an electronic and computerized aspect that we're taking all those into consideration.
For the first time ever in our ICU, we will have the capability of a family member to stay in the room with the patient if that's what they choose to do. And so the services and the comfort, the privacy of the new ICU will be able to provide something that we haven't been able to do at this time.
I think once the ICU expands and we have more space, more personnel, better equipment, improved technology, that we'll be able to supply care here in the community rather than having people be transferred to other facilities.
In this region, we need to be able to have the best health care possible. And intensive care is vital, especially for older citizens. That cannot happen without that level of commitment from the community.
Integration of care, particularly now with cardiac development, ICU development, neurology development, surgical development, is going to raise the level of expertise and care in Titus to the whole new field.
What we would like to see from the community is to give us a chance to provide excellent care. I believe over the next 5 years we will have the infrastructure and the resources to deliver at least equivalent, if not better care than the surrounding tertiary care centers.
Having a hospital that you can come to and assess that the doctors know you and you know your doctors, and you can be taken care of by someone that really knows you and really cares about you.